All right, guys, let me give you a little context around what you're about to see. I'm going to use OpenAI's app, ChatGPT 4.0, to record an interaction. Now, this is all mock. None of this information is real, and you can't put real patient information into ChatGPT 4.0 because it's not HIPAA compliant. But I want to kind of give you an idea of where all of this might be going and start to prepare you for the future. I really think that we can create an AI that will contact the patient, ask a series of questions to do the pre-admission so that when the physical therapist is face-to-face with the patient for the first time, that therapist has all of the information he or she would need to initiate the best possible patient care experience. I also think we can train the AI specifically on the third-party payer for that patient. So what I did was I went into CMS Chapter 15, took Section 220, the documentation section. I put that information into ChatGPT, asked it to create a series of 10 questions that it would ask a new physical therapy patient to take the information that was provided by the patient and help to establish or begin the framework for an initial evaluation. So those questions are already generated. The information's already in here, but let me show you what a real patient experience would be like. I'm going to queue it up just so that you kind of see where it is. I would like you to follow the same process for a new patient. Let's begin.
Of course. Let's get started with the first question. What is the specific issue or condition that brings you in today?
I've been dealing with some left hip pain that won't go away.
Thank you for letting me know. When did you first notice the hip pain, and how has it changed over time?
The hip pain started about 6 months ago. I went on a hike with my family. When I got back, it started to feel sore. By the next morning, I could barely walk.
That sounds quite painful, especially after such a sudden onset. Have you been treated for this hip pain before, either by a physician or another therapist?
I have not seen another therapist. I went to my chiropractor who tried several adjustments, but it did not improve the pain. I went to my primary care doctor who prescribed some oral medication, but the pain is still there.
Thank you for sharing that history. Are there any other health issues or conditions that may affect your treatment or recovery?
None that I know of.
That's helpful to know. What medications are you currently taking, if any?
I'm taking the prescribed anti-inflammatory my doctor recommended. I don't know the name of it, but that's the only thing I'm taking.
Thank you for sharing that. How would you describe your overall health at this time?
I think I'm pretty healthy. I don't have any medical problems, and I haven't had any surgeries.
That's great to hear. Where do you live, and do you have support at home to assist you with daily activities if needed?
So I live in a house with my wife. I have 4 young boys. I have plenty of help around the house in case I need it.
It sounds like you have good support at home, which is always helpful. What are your main goals for physical therapy? What do you hope to achieve?
I really have been dealing with pain that's waking me up at night, so I'm not getting a good night's rest. When I'm working at the office, I mainly do computer work. It doesn't bother me then, but I haven't been able to do my normal hiking and exercise that I really enjoy.
Thank you for sharing that. We'll focus on helping you get back to your normal activities and improving your sleep. Do you use any medical equipment at home, such as a walker or brace, to assist with mobility?
I do not.
Thanks for confirming that. 10. Based on your experience, how would you rate your ability to perform daily tasks such as walking, dressing, or cooking, considering the hip pain?
I missed that question. Can you ask me again?
No problem. I can ask it again. How would you rate your ability to perform daily tasks such as walking, dressing, or cooking, considering the hip pain?
It's been a problem. Everything that I do on my feet's been increasing my hip pain, so I've been having to stop, take breaks. I can't cook meals for my family, and walking is limited to about 10 minutes.
Thank you for that detailed response. It sounds like your hip pain is significantly impacting your daily activities. We'll make sure to address these issues in your therapy plan to help you regain your ability to move comfortably. That wraps up the initial questions. With the information you've provided, we can develop a targeted plan to help you get back to your normal routine. I look forward to working with you on this.
Thank you. Goodbye.
You're very welcome. I'm here to help. I look forward to seeing you at your appointment. Take care until then.
Okay, so obviously I answered that like the perfect patient. I knew what questions he was asking. I knew what answers he wanted. I'm saying he because it's a male voice, but I do think that this technology will continue to improve. I think it'll ask clarifying questions. It'll dive deeper. When it says, where do you live? I think most people would probably give a street address, but I know that the question comes from Medicare guidelines for living environment. Now, that all took place theoretically over the phone before the patient ever comes into therapy. So the therapist would be able to look at the answers to all those questions. But what I'm going to do is I'm going to cue it and let's see what I can get out of it. Now, can you take all of that information from the last patient interview and put it into a form of clinical documentation, some sort of summary, so that you can give that to me as the physical therapist?
Certainly. Here's a clinical documentation summary based on the information provided during the interview. Patient name, date of evaluation, subjective. The patient presents with left hip pain that has persisted for 6 months. The pain began after a family hike where the patient experienced soreness that escalated to severe discomfort by the next morning, affecting the ability to walk. The patient reports that the pain has not improved despite chiropractic adjustments and prescribed anti-inflammatory medication from their primary care doctor. Medical history, no known health issues or other medical conditions. No history of surgeries. Medications, currently taking a prescribed anti-inflammatory medication, name unknown. Social history. The patient lives in a house with a spouse and 4 young children, providing ample support at home if needed.
All right. So you get the idea. You see where that's going. Just so you can kind of see, I don't know how well you can see that, but everything that it was just reading is typed out in a typed narrative. So this is information that could go direct from text into the EMR. Now, the more skilled you get as a therapist, the more the technology advances, the better formatted everything is going to be. I think you guys know I use HippoScribe for my AI scribe technology. HippoScribe allows me to record human-to-human voice interactions and then turns it into clinical documentation with a little bit of prompting, but it's the same thing. So now what I'm doing is I'm removing one of the humans, which hopefully is the therapist, allowing the AI to interact and communicate with the patient before the first initial evaluation is ever happening as a way to collect information. Because remember, it's not billable time unless you're face-to-face with the patient. But if you can collect all of this information ahead of time and then have it in your EMR and formatted and structured the way you specifically want as the therapist, you can know way more about that patient coming in the door than was ever possible before. So I'm just sharing ideas.